Thank you for tuning in to Friday's edition of COVID-19. A decision on the fate of the level 2.5 social distancing in the metropolitan area that is poised to end this Sunday has yet to be disclosed. Given the recent trend in daily infections, authorities appear cautious about a hasty decision. What's more, the upcoming flu season looks to further complicate matters, and we'll delve into that later on in the program. Here first, I have our Kwon So-ah and Kim Ji-yeon with the latest news on the pandemic. I'll start with you, So-ah. There has been a tangible rise in new cases on this Friday here in Korea. Please tell us more.
Yes, Sunny, we are wrapping up the work week with an increase in COVID-19 cases. Always a concern ahead of the weekend because people do not only commute to work, and that is why health authorities are asking for the nation's people to stay at home. But they also have been thanking the nation's people for their cooperation in social distancing and for helping to maintain the numbers this entire week in the 100s.
Right, but what remains a concern is there is no tangible plunge in cases as of yet.
Good point, Sunny, and that is why health authorities are asking for continued social distancing over this weekend. And this weekend, we will likely hear whether the 2.5 level social distancing measures in the metropolitan region will be extended or downgraded. And it is a tricky situation because we have been seeing some positive figures, which means for 9 consecutive days, we have been seeing figures in the 100s, but we also saw some increases by the end of the week, and also before we had cases surge to above 400, so that is an improvement. But if we look back to the beginning of August, cases were in the double digits, and that's where authorities want the figures to be, but there's still a long way to go with 176 cases reported this Friday and 4 fatalities, raising the death toll to 350. And in the meantime, the number of people in quarantine has declined to below 4,000, but we have some 175 people currently in serious or critical condition. That is about the number of the new caseloads we are seeing today. And in the meantime, we are seeing an uptick in cases in the metropolitan region, 118 cases combined in Seoul, Gyeonggi-do province and Incheon, with 63 in Seoul. So today we are seeing more than in Gyeonggi-do province. And again, double digits in Chungcheongnam-do province as well as Daejeon. Meanwhile, the country reported 15 cases from overseas this Friday. And imported cases reported this Friday in Korea include patients from the US and India. India is seeing unprecedented figures. Almost 97,000 cases were reported in the past 24 hours. And over in Spain, in Europe, we have cases, death toll nearing 30,000. That's also similar in France, which already has over 30,000 cases. And here, a serious resurgence is happening with some 10,000 cases reported in just a day. Meanwhile, here in Pakistan, this country is expected to become the next country with over 300,000 cases. And that's about the number we're seeing in daily cases globally, with also almost 6,000 fatalities and 241,000 recoveries. And those are the figures I have for now, but I'll be back after the government briefing with the chief of the Korea Centers for Disease Control and Prevention, Jung Eun-kyung, who has been appointed by President Moon Jae-in today to lead the KCDC's upgraded KDCA, which stands for Korea Disease Control and Prevention Agency. And I'll be back after the briefing. Sunny?
All right, so thank you for that for now. Back on the local front, the government is seeking to extend a tangible lifeline to those struggling financially amid the pandemic. I have our Kim Ji-yeon with me in the studio with details on the financial aid. Welcome, Ji-yeon.
Hello again.
Right, Chen. So apart from the $6.6 billion under the fourth supplementary budget, relevant agencies have come up with additional funds, I hear. Please tell us more.
That's right. Right after President Moon Jae-in explained the aim and scope of the extra budget, the economy-related ministries, the Health Ministry, the Education Ministry, and others have laid out detailed plans to back the economy, people's livelihoods, and the fight against COVID-19. It's been dubbed the Emergency Livelihood and Economic Package.
Using funds the administration already has, the government will put in another $3.9 billion in addition to the $6.6 billion in the fourth supplementary budget.
Out of the $6.6 billion extra budget, a lion's share of more than $3.2 billion are being sent to support small merchants and small and mid-sized businesses who are suffering from the government's social distancing measures. And the government is hoping to avoid the criticism it faces over its supportive measures, which some citizens say are going to be unevenly distributed.
I see. So who are eligible for the financial assistance and how much can they expect?
Well, for businesses that have suffered due to the coronavirus and have recorded annual sales of less than $337,000, they're eligible to receive $843. That excludes restaurants and coffee shops, which get more, some $1,300. And that's because they're subject to more stringent distancing guidelines, which includes limited operating hours and a seating ban. Business owners of high-risk venues such as internet cafes, private academies, and reading rooms are eligible to get even more, some $1,700.
Xian, on a more grim note, what about those who've lost their jobs due to COVID-19?
Right, nearly $1.2 billion are being set aside to stabilize the job market, with Korea's employment figure falling for 6 straight months leading up to August, the longest streak since 2009 during the global financial crisis. And for freelancers and workers who are not on unemployment benefits, estimated at 700,000 in total, and this includes private tutors, private academy instructors, door-to-door salesmen, and nursing workers, among others. They're eligible to receive anywhere between $420 and $1,300, and the amount varies depending on whether they received the government's first round of aid handouts earlier this year.
I see. I suppose these handouts will offer them some form of short-term relief then?
That is right. It's particular to those who have to support their families. A total of $337 million have been earmarked to support the livelihoods of the low-income families. Households with 4 or more members are eligible to receive a maximum of $844. Families of 4 or less are getting less than that amount. And to alleviate the burden of parents with children who are unable to go to school due to closures, the government says it's setting aside $1.8 billion for child care services. Up until now, the government has been providing some $170 to parents for each child under the age of 7 to support child care. That's being expanded to parents with children in elementary school. With that, the parents of some 5.3 million children will be eligible to receive aid from the government.
I see. Jian, can you tell us more about the additional $3.9 billion budget that has been drawn up to support containment efforts and the economy?
Today's all about numbers.
Right.
Sure. Out of that budget, more than $3.3 billion will be spent on the economy. That includes the execution of state investment funds and helping exporters find online buyers. And the rest is being spent on COVID-19 testing and treatment and the purchase of vaccines. This comes with the government looking to work overtime to contain COVID-19 ahead of the Korean Thanksgiving holiday Chuseok. And the package also aims to stabilize consumer prices while boosting domestic consumption. The government aims to implement these measures as soon as possible so that they can be implemented before the holiday begins on September 30th.
I see. All right, Jian, thank you for that coverage. Have a safe weekend. Hope to see you again soon next week.
Me too.
Right, we turn now to the regular afternoon briefing on COVID-19 here in Korea. Daily cases remain within the 100 range, but concerns persist over the growing number of patients in critical condition, the presence of untraceable transmissions as well as asymptomatic patients and sporadic cluster infections. In fact, the number of patients in intensive care has risen to 175 as of today, up by 6 more patients from the day prior. Now, back on August 18th, the number of patients in need of such care stood at just 9. Also, during the past 2 weeks, between 30 and 40% of people testing positive for the virus had no symptoms. They were simply detected during contact tracing by authorities. Moreover, the transmission routes of almost 23% of new cases over the past 2 weeks have yet to be identified. And against this somber backdrop is the reality that sporadic cluster infections continue at call centers, small dining places, sales events, religious gatherings, nursing homes, and more recently, hospitals, including the Severance Hospital here in Seoul. Authorities in response are urging for efforts to better protect the sick and the elderly as they remain particularly vulnerable to the virus. Now, we are still waiting for the briefing to commence, and perhaps while we do, we can take a look at today's figures for Korea on this Friday. I understand we have 176 new cases on this Friday, raising our total to 21,919. We lost 4 more lives, raising our death toll to 350. Our fatality rate as of today now stands at 1.6%. Those in quarantine stands at below 4,000, and those who fully recovered from the virus stands at 17,616, meaning that roughly 4,000 active cases of COVID-19 are prevalent in the country as of this Friday. Also on the screen, we have the level 2 social distancing that has been kept in place, that is, for the rest of the country, with the exception of Seoul, Incheon, and Gyeonggi province that face the tougher level 2.5 social distancing. The rest of the country has level 2 social distancing, and this will last until the 20th of September. Gatherings indoors has been restricted, that is, to a maximum of 50 people, and for those outdoors, we can have a maximum of 100 people. No spectators are allowed at sports events, including those for football and baseball. And operations at high-risk facilities that include a total of 12 have been asked to suspend their operations. The briefing is about to start. We'll come back to you with a summary of that with our consul later on.
먼저 정은경 본부장
First of all,
설명이
we
있겠습니다.
have Ms. Chung Eun-kyung, the director, for the explanation.
네, 코로나 바이러스 감염증 19
Let us now
국내
begin
발생
our
현황을
regular briefing on the
말씀드리겠습니다.
COVID-19 response here
9월
in South
11일
Korea.
기준으로
As of
국내
September
발생
11th,
신규
Friday,
확진자는
we have a total of
161명이
161 new local
확인되었고 해외 유입
infections
사례는
and
15명이
15 new
확인되어
imported cases.
총 누적
The
확진자
total
수는
caseload now stands at
21,919명입니다.
21,919.
현재는 3,953
Right now, we have
명이
about
격리 치료 중에 있으시고
3,953 people in quarantine, and 175 of them are critically ill. And yesterday, we had 4 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families.
국내 주요 발생 현황에
Let us
대해서
now take a look at
설명드리겠습니다.
our major updates of domestic transmissions related to the August 15th Seoul rallies. We have 7 additional cases being confirmed. In total, the accumulated number stands at 564.
서울 서대문구 세브란스
And in
병원과
relation to the
관련하여
Severance Hospital in
접촉자
Seodaemungu
조사
District,
중에
Seoul City, we have 9 new
추가로
cases
확진되어
being confirmed. In
현재까지는
total,
누적
we have
확진자가
a
총
total of
19명입니다.
19 cases being confirmed to
현재는
date.
의료진이 2명이고
Of them, 2 are medical medical staff, as well as 1 patient, and the rest 4 are families and professional caregivers. And in relation to a construction site in Dobonggu District, Seoul City, we have the index case on the 8th of September. We have 6 additional cases since then, and in total, we have 7 cases being confirmed to date. And in relation to an online hiking group in the greater capital area, we have 6 additional cases being confirmed. In total, 35 cases have been confirmed to date. Among them, 19 are attendees of the meeting and 16 are family members and their acquaintances. And moving on to Gyeonggi-do province in Icheon City at a welfare care center, we had the first case earlier this month, and we have 13 additional cases, and in total we have 14 cases to date. And in relation to an Seomgim Nursing Hospital in Chungcheongdo province, we have 7 additional cases being confirmed. In total, we have 9 cases being confirmed to date. In relation to the health supplement business seminar in Daejeon City, we have 12 additional patients being confirmed. In total, 51 cases have been confirmed to date. As of today, we have 15 new imported cases. Of them, 9 of them have been reported through points of entry, while 6 have been reported during self-quarantine. And as for the country they were from, 2 were Philippines, as well as Uzbekistan, Indonesia, and Australia. And lately, we have seen a significant surge in the number of elderly patients, as well as those who are critically ill. Of the past 4 weeks or so, About 34% of the new cases are above the age of 60, and during the past 3 days, over 40% of our new cases are above the age of 60. And as for the roots of these senior citizens, we have found the roots of infections to be 21.5% related to religious facilities, and also contact with other confirmed cases were 21%, and 9% were related to the rallies, and 8% related to other multi-use facilities, as well as 5% related to business seminars carried out by door-to-door sales. And we have 155 patients who are critically ill. Of them, 87% or about 153 people are above the age of 60. And as for the elderly people and those who have underlying illnesses, they have greater risks of developing severe symptoms. So this is why we need to take particular precautions as for these senior citizens. And this is why we will be going through some guidelines that need to be practiced by the elderly as well. And during the weekend, as for the religious facilities, we ask you to switch to online means and non-face-to means, and we ask you to refrain from having social gatherings and also small group meetings and group meals during the outbreak of the coronavirus. And as for large-scale rallies, please note that there could be a lot of singing and slogans and chanting, and there could be also very close contacts with other attendees, and therefore we also have a higher risk there as well. And there are also many people coming from different regions, meaning that all of the people gather at one place, and so that this is why we ask you to refrain from attending these group rallies. And as for the multi-use facilities like cafes and other facilities, we ask you to frequently ventilate as well as disinfect the frequently touched areas and wear your face mask at all times. And also wear your face mask at all times at other venues as well. And we are seeing door-to-door sales as another major venue of cluster infections, and we advise all of the senior citizens to refrain from going to business seminars carried out by these door-to-door sales, which engage group eating as well as a large cluster of people sitting in close contact environment. And especially during the latest outbreak, we have also seen that these business seminars have been a major source of infection, so we ask you to refrain from going to these places. We also see a higher risk of infection carried out through nursing hospitals and nursing homes, so we ask these facilities to carry out ventilation as well as disinfection on a regular basis. And we also ask you to have a strict control of the number of visitors. And if you feel unwell, please get tested as soon as possible. And you should also refrain from going to other large group gatherings as well. And also abide by the quarantine guidelines at all times while at work. And as for the senior citizens, please, if you have any symptoms like fever or respiratory symptoms, and if you do not feel well, please get tested as soon as possible by visiting a nearby screening clinic. And also at many health centers and clinics, if you see some of the symptoms of COVID-19, some suspected symptoms, please test these patients as soon as possible so that they can get fast testing. In order to curb the further spread of the virus, the participation of the public in social distancing is very important, and this goes for the weekend as well. During the weekend, we ask you to postpone or cancel any non-essential outings, social gatherings, events, or travel. And please stay home safe and sound with your family members. And please also wear your face mask and keep 2 meters of distance at routine daily lives, and continue to wash your hands on a regular basis as well. Globally, we are seeing a continued pandemic, and this is not nearing any downward trend. It is seeing a global confirmed cases of 28.3 million, and the death toll also surpasses 900,000. And in many European countries, they are also re-intensifying their quarantine measures as they see a resurgence of the virus. And please note that a lot of the cases of COVID-19 spreads when there are no symptoms, and this is highly infectious as well. So we believe that the disease and the pandemic will be prolonged as well. Our quarantine officials here in South Korea, we will also continue our best efforts to undertake quarantine measures so that we can maintain the full control of the virus. And we believe that this is our major goal right now. And as for now, we do not have an effective therapeutics or vaccine against the virus. We believe that the only way for us to effectively curb the virus is to cut the chains of transmissions by wearing face masks and keeping 2 meters of distance and also minimizing social contact. Nevertheless, when COVID-19 pandemic prolongs, it is a very difficult task for us to strike a balance between quarantine and daily routine. If we ease our quarantine measures, this will lead to a major outbreak, thereby increasing the number of fatality rate as well. And if we intensify our quarantine measures, many of our daily lives and daily routines as well as livelihoods are damaged. And therefore, it is all about seeking a right balance between the two, and we believe that making a new change and adapting to these new normals are very important. So we need to effectively carry out social distancing measures and quarantine measures by the users and the managers of these multi-use facilities, including cafes, restaurants, as well as private academies. And we need to carry out our quarantine routines and quarantine guidelines and make them a part of our habit as well. And our quarantine authorities will also continue to exert our full efforts and will support institutionally, and we will also provide the principal effective guidelines going forward as well. Thank you very much.
Right, that was Friday's afternoon briefing by Chung Young, the head of KCDC. So do give us the gist of her address today.
Well, Chung really focused on the COVID-19 elderly patients this Friday, and that because people aged 60 and above accounted for 34% of total cases in the past month. But in the past 3 days, this percentage even was at around 40%. And we also have 175 people in serious or critical condition, and 153 out of those, again, were people aged 60 and above. That means over 87%. And most of these cases occurred at religious facilities, at small gatherings, as well as rallies. This is why she called on adherence to quarantine measures when you're at high-risk facilities, or just refrain from attending those gatherings. And she also asked for the nation's people to abide by the 2.5 level or level 2 social distancing measures throughout the weekend and beyond, but she did not yet mention whether there is going to be a potential extension or not.
I see. All right, so thank you for that. And today's address by Chung marks her last as the head of the KCDC, as you mentioned, because starting from tomorrow, that is Saturday, she leads an upgraded state entity called the Korea Disease Control and Prevention Agency. Right?
Exactly.
All right, so have a good weekend. I'll see you on Monday.
You too. Stay safe.
Right, now, as we've been highlighting in recent days, prevention is of utmost importance amid the pandemic. In this next corner, we take you to a factory that manufactures protective suits for medical workers at the front lines of the battle against COVID-19. Our Chun Song-cho joins us now. Hello, Song-cho.
Good afternoon, Sunny.
Song-cho, do start by telling us where you are.
Yes, I'm in Osan City, south of Seoul, at TNB Company's factory. Well, this company usually manufactures eco-friendly silicone products ranging from kitchen appliances and pet toys to swimming goggles and caps. However, in response to the COVID-19 pandemic, the company has shifted its business to producing PPE, or personal protective equipment. It has rearranged its entire workforce to ramp up its production in order to meet a recent surge in demand. And yes, I understand there are only a few workers behind me working here, but there are said to be about 50 workers working in all different factories, and they're producing on an average of 2,000 suits per day. That's a lot. And all of those finished products will then be supplied to frontline workers, government officials, and disinfection service professionals. And yes, I am fully geared up. As you can see, from head to toe, I have this face shield on, which is being assembled right here. I have goggles, isolation, gown, and foot covers. I mean, it was quite difficult to put it on. Donning it was very complicated because all of these items are all separated, and I actually had to get help from other people. And doffing it's as complicated as donning it, I heard, because you have to make sure that you are not touching the outside material while you're taking it off. And as you can imagine, it can be quite tricky. Well, but I mean, since fortunately there are very low risks of contamination here, so let me take it off. It feels so much better, and can you actually see the marks on my face? I mean, I cannot imagine having to suit it up for hours on an end because I get very stuffy and hot inside with limited airflow, even when there is an AC on, so I only have respect for those medical professionals who have to wear this for hours and hours. I mean, some of the iconic images from the heroic response to the pandemic are the faces and hands of medical professionals, all bruised up and wrinkled by PPE during long hospital shifts, right? So I just want to say that let's do all our part and do simple things like performing hand hygiene, avoiding outdoor activities, and following the social distancing guidelines. If you do all those simple things all together, then we can make a great difference in quelling the pandemic. This has been Jeon Sung-cho reporting live from Osan, and back to you, Sunny, in the studio.
Indeed, Song-cho, the protective suit you're wearing is part of the daily discomfort and difficulty endured by our health workers since the start of the pandemic. Again, our gratitude to those at the front lines. And Song-cho, thank you for that coverage.
환절기에는 감기나 독감 환자가 늘어납니다. 여기에 코로나19 확산세가 더해지면 국민 건강이 심각하게 위협받을 수밖에 없습니다.
코로나19와 인플루엔자 동시 유행에 대비하기 위하여 인플루엔자 예방접종 무료 지원을 시행합니다.
Countries in the Northern Hemisphere have a fresh concern in light of the seasonal transition from the warmer months of the summer to the colder months of autumn and winter. The dual challenge of dealing with the seasonal flu and tackling the pandemic. For more on this so-called Twindemic, I have Dr. David Kwak from Suncheonang University Hospital. Pleasure to see you again, Dr. Kwak.
Good afternoon.
And with social distancing in mind, I have Professor Chung Sun-jae from Yonsei University live on the line. Welcome, Professor Chung.
Thank you for having me again.
Also over in the US, I have Professor Ellen Foxman from Yale University. Welcome, Professor Foxman.
Thank you for having me.
Right. Dr. Kwak, we'll start with you. For more than a week now, the number of daily infections here in Korea has been hovering within the 100 range. But there's been a steady yet subtle rise in cases in recent days. What are your thoughts on the current COVID-19 situation here in the country?
So the decline in numbers I'm seeing is very gradual, I can say. But what worries me is that the number of unrooted infections, we're still seeing it rise up to about 24% of the newly daily cases. I believe because they're unrooted, they're untraceable. I think the number, unfortunately, is going to stay quite high in the 150s or 170s, possibly. Hopefully, it'll gradually even go down even further. But at this time, there are no cluster infections or the massive numbers that happens that we can get away with. So hopefully, if we keep a stricter social quarantine measures and governmental measures that we keep, hopefully it'll go down even further. But at this point, I think somewhere in the hundreds is the number we're going to keep continuing to see.
For a little while then. Professor Chung, amid this scenario, there is mounting concern over the upcoming flu season this year. What are some of the major concerns, Professor Chung?
Yes, so I think the most worrisome thing is that there would be a shortage of medical resources by both viruses. The COVID-19 and seasonal influenza show similar symptoms such as fever, headache, myalgia, cough, and it is hard to distinguish by the time of diagnosis. Both viruses cause respiratory symptoms, which manifest as asymptomatic or symptomatic to serious illness and death. As far as you know, the mortality of influenza is about 0.1%, and COVID-19 is around over 1% when we consider about the asymptomatic cases also. So especially those who are at risk populations, such as older population or people with comorbidity, can be lead to severe symptoms or even mortality. In particular, both viruses are transmitted by respiratory droplets or contact, and the possibility of co-infection is raised. So regardless of the synergetic symptom severity, it has been proposed that infection with one virus may be more susceptible to infection with other virus. However, influenza alone can cause serious complications such as pneumonia, and even when there is no COVID-19, the number of ICU patients increased during the winter epidemic, and influenza caused about 2.8 million patients per year. The limited number of medical resources will be crucial in these seasons, and it is also said that the medical system could even collapse if we consider the input of medical resources and medical personnel already taken due to the COVID-19.
Right. Dr. Kwok, given that concern, there have been reports of people being infected with both the seasonal flu and COVID-19. How worried should the public here be about such infection?
Well, I can't really put a statement on to how worried we should be, but it is definitely a huge infections that are going to happen at the same time. And that's something we worry about, particularly because, as Dr. Jung mentioned, it's more about medical care capacity that we can handle both at the same time. We already know that every year or so, towards the end of it, we get hit with influenza every year. But with the situation with COVID-19, if we cannot minimize the number of people with influenza, we're going to have some serious trouble handling both patients at the same time. And also, as Dr. Chung mentioned, co-infections are proven to be possible, even with COVID-19. Well, I'm not going to say that they are going to be more serious with the disease, but when somebody has double the infections, it also means that he or she is going to be treated with different regimens or different medications that'll also take into the medical care capacity that we have to worry about. So going into the fall season and the changes of the season, we would have to start thinking about how we're going to manage really the two major the infections that are about to happen.
Right. Professor Fox, like Korea, the US is also in the Northern Hemisphere. Are concerns of a twindemic also prevalent in the US? And if so, how are authorities there seeking to prepare for the upcoming dual challenge, so to speak?
Yes, absolutely. That's of a big concern. But the thing that's different about flu than COVID-19 is we actually do have a vaccine already that's safe and effective. And there's a big effort to make sure that those vaccines get to people before the flu season begins. So this is the time right now where you're starting to see a lot of people getting the flu vaccine to prepare and prevent the virus that we can prevent because we already have a vaccine for it.
And are authorities in the US actively calling on members of the public to get themselves vaccinated?
Yes, there's a lot of very positive messaging to this is something that we can do, that we can all do and take control of to help contribute to the fight against the upcoming season.
Right. And this is also probably because, Professor Chung, I understand that countries in the southern hemisphere, including Australia, noted a record low flu season in light of the widespread vaccination there. Please tell us more about this, Professor Chung.
Yes, I think this vignette in Southern Hemisphere is reflecting a sort of hopeful situation for us too. For example, the Australia showed the increased number of 18 million flu shots, which can be compared with the number from 13.2 million in 2019 and 11 million in 2018. The additional vaccines were distributed to GPs and pharmacists, which were secured by the Australian government through the National Immunization Program in response to unprecedented demand due to COVID-19 outbreak. And as a result, along with COVID-19 control measures, this vaccination has been known to dramatically reduce the transmission of flu in many Southern Hemisphere countries this season. So, well, people raise the issue that there would be some underestimation of detecting the true flu cases due to reduced medical use or screening. However, we can be certain that there was no significant synergistic interaction we worried was found between seasonal flu and COVID-19 due to relatively low influenza cases. And this is why people think vaccination against the flu become particularly important this year under COVID-19 prevalence.
I see. And just to add on to what Professor Chung has just said, the flu season in the Southern Hemisphere coincided with the outbreak of COVID-19. But figures for August 2019, that's last year, Australia recorded 61,000 laboratory-confirmed cases of the flu, whereas this year in August, they only saw 107 cases, which is why, Dr. Kwak, back here in Korea, authorities have expanded their free flu vaccination for those in the country to include 19 million people. Now, vaccinations for children started this week, and other groups eligible, I understand, are those between the ages of 9 and 18 and pregnant women, as well as senior citizens aged 62 and above. When would be the best time to get your flu shot? And if you were vaccinated, let's say earlier this year, do you still need to get another one?
Well, I believe, I'm just going to specify it on a date. I believe for the elderlies, I think it becomes free of charge on September 22nd. So let the people know that. But also, in regards to the vaccinations, flu vaccine is known to be valid for about 4 to 6 months for its full effectiveness. And then it starts waning off. So considering the possibility of COVID-19, possibly staying into spring of next year, I think it'll be best if we could, well, first of all, all of us have to get it. Number two, if we could get it somewhere around in between late September to early October. The usual timing was actually mid to late October for the usual flu season. But in this case, because we want everyone to get it, I think the distribution has to be more distributed out. So I'm going to say that whenever we can. But hopefully within the time period of early October to mid-October, I think that'll be the best. And in regards to your question, if somebody got a flu shot this year, could somebody get it second time? Yes, because usually it's not recommended more than once a year. But every year or so, the flu vaccine is developed for a very specific strain that is expected to go around for that year, for that season. That being said, so for the season, for this particular season that we're going into, the flu vaccine has come out just particularly for this season. So I'm going to say if somebody has received a flu vaccine, let's say in January or February time, I think it'll be more recommended for those people to receive another one, hopefully going into September, late September and October.
I see. Well, that's good to know. Professor Foxman, you conducted a study showing that the common flu can prevent the flu virus by jump-starting the body's immune system. Could you tell us a bit more about this, Professor Foxman?
Yeah, sure. Actually, so this is a study that just came out last week. We were very curious because it's been documented that it's very rare to find people who have a common cold and the flu at the same time. And we also know from the seasonality that generally when the children go back to school, first they have a common cold and then the flu season comes after. And so we looked into this in detail at what might be causing this. And we found that the sort of, when you get the common cold, it causes antiviral defenses in your body, in your airway, that last about 1 to 2 weeks. And those antiviral defenses can actually prevent a second virus. In this case, we looked at the flu virus from infecting at that time window. So that might be, understanding that may help us better predict when the timing of these epidemics occurs, which is still a bit of a mystery.
Professor Foxman, I ask as a layman, now based on the results of your study, could we perhaps expect a similar relationship between the common cold and COVID-19?
That is possible because the defenses that we looked at are broad. They cover basically most viruses. So it's possible, but we are actually studying that now because we want to test it and know for real if that happens.
I see. And once your results are available, I'll probably have you online again. Professor Chung, authorities, I believe, are looking to adopt a new test kit that can detect both COVID-19 and the flu virus. What are your thoughts on this test kit, on this initiative?
Yes, as I know, one company that developed a pre-existing COVID-19 test kit developed a novel test kit that can test 5 types of respiratory virus simultaneously. And this includes COVID-19, influenza A and B, and RSV A and V. As government is propelling its fast-track approval from Korean FDA, I think it'll soon be used in public. However, when multiple diagnosis is made with limited sample, the limitation of its accuracy must be clearly reconsidered. Even so, regardless of accuracy, it seems that a more rapid test is possible with these kits. Before this, the person may have undergone 2 separate PCRs, which takes relatively a really long time. So, for example, it could be used for people who need to be differentiated due to similar symptoms between COVID-19 and others. And also, as this test focuses on sensitivity, it can be rapidly applied into people who need to be isolated and treated in a short time.
Staying with testing, Dr. Kwak, it's important, early testing, of course, to detect the virus. But would you advise people to seek testing centers should they show symptoms like fever and coughing, or should they simply visit their local clinics first? What are your thoughts on that?
I am actually going to refer to Director Chung on this. I was listening to Director Chung mention that whoever feels sick right now should immediately go to hospital and be tested for COVID-19. Symptom-wise, if we talk about common cold or influenza or even COVID-19, they all share very similar symptoms. There is no specific or particular way that we can differentiate them clinically speaking. So only way we can really differentiate them and treat them accordingly is through testing. So if anyone is feeling sick or having, let's say, respiratory symptoms or even fever, they should not hesitate to go to hospital and be tested for COVID-19.
Right, better safe than sorry. Professor Foxman, amid the ongoing quest for a vaccine, 9 leading pharmaceutical firms from the US and Europe agreed that they would only seek approval for vaccines that meet scientific and ethical standards, underscoring safety as their top priority. Is this a step in the right direction, in your opinion?
Oh, absolutely. In that safety is the top concern that we have to make sure of. We want a vaccine that's going to work and help people, but we want to make sure that it's gone through all the proper channels to make sure that we cause no harm. So we have a very good process usually for vaccine development of checking and rechecking to make sure that this is beneficial and not harmful. And I definitely approve of putting the safety first.
Right. Dr. Kwak, we are looking at the weekend starting from tomorrow. What are some of the safety measures that members of the public should seek to abide by in light of the reality that we had 176 cases today?
Right. Along with the serious numbers, we're also looking at very good weather changes. We're looking at cooler weather and less humid weather. So everybody's going to feel like they want to go outside and enjoy a little. I'm going to reemphasize now is really not the time. I'm going to urge everybody to join us in fighting against this particular virus and keep to yourselves for hopefully for some time being and really keep the social distancing. Well, wear the protective mask always, but also if you had to go outside for a little, then make sure that you wash yourself very cleanly. The physical distance is the probably only thing that we can hold on to fight against the virus, so better we keep it.
Right, so wear your face mask, wash your hands, watch your distance. What about you, Professor Chung? Any final words for our audience ahead of the weekend?
Well, we are doing really hard courses, I think, and people are, really exhausted about the situation right now. However, if we lose just this moment and we just get loosened and just go out and just enjoy for a while, then it can bring a huge burden to everyone. So please keep social distancing and also keep your mask on and keep your hands clean at every time, and let's hope for the better future.
Professor Foxman, over in the US, a few words for our audience as well.
Well, I agree with what everyone has said here, which is we should feel, even though we don't have a vaccine for the COVID-19 virus yet, there are a lot of things that we can do. And we're empowered to do those things, which include getting a flu vaccine and doing what we can to stop the spread of the virus. And it really can be, it's simple, but it really can be quite effective.
Right. All right, Professor Foxman, Professor Jung, thank you for joining us on the line. And Dr. Kwok, as always, thank you for being with us today.
Thank you for having me.
Right, well, that ends our coverage of COVID-19 for this week. Daily cases here in Korea, while within the 100 range, have been noting a subtle yet steady rise this week. To ensure a prompt return to level 1 social distancing, we ask for your support of current safety measures, including the refraining from unnecessary outdoor engagements and the wearing of face masks. Have a safe weekend and see you on Monday.